Hello everyone. We are here to present an OET role play. I am Mary George and with me I have Jacob John who will play the role of a candidate. I will play the role of a reluctant patient in a hospital setting. In this speaking session, the patient has undergone an emergency appendectomy last night. Now she is agitated for not having her concerns addressed on time. Let's begin. You have 3 minutes to prepare. Your time is up. You can begin.
Good morning, Miss Sonia.
Good morning.
How are you feeling today morning?
I'm feeling miserable.
Oh, I can make it out from your face. You're feeling a little bit upset. Can I know the reason?
I think you know I underwent an emergency appendectomy last night.
Yes, I'm aware of it. You had an emergency appendectomy yesterday night.
And I was in severe pain.
Oh, I'm really sorry to hear that. Didn't you take your medicines properly?
I did, but that was not enough.
All right.
And I called the nurse on duty last night.
Oh, I see.
And I asked her to give me medicines and she didn't appear.
I'm really sorry to hear that again. I was not aware of that, but there is a reason behind it. Would you like me to explain it to you?
Okay.
There was a flu epidemic and we were totally understaffed. So just because of that, less experienced staff were put in this particular ward.
That is not something that I should consider. Do I pay for it?
No, you don't exactly pay for it. I do understand the situation, Sonia.
But she refused to understand that I was in pain. She could have given me the medicine and gone.
Yes, I'm really sorry. Since, as I told you, we all were understaffed. Just because of that, they had to attend more than 4 or 5 patients in this particular ward. And sometimes you might have noticed when we are understaffed how busy this ward is.
This is not all that happened. Something else happened.
Oh my, I'm really sorry to hear that again. Would you please explain it to me?
I wanted to go to the washroom.
All right.
And I pressed the bell and I wanted her to come and help me.
All right.
But she didn't appear.
Oh.
And repeatedly I kept calling and calling, but she wouldn't come.
I can understand that situation.
For a
Sonia.
long time, and I had to go to the washroom all by myself with this pain.
Oh, I see. I'm really sorry to hear that. Would you like me to call those nurses and ask them in front of you?
No, I don't want that. But I don't want this repeated tonight.
Yes, it will not be. I give you my word. I assure you it won't happen again.
But how do I know it's not going to happen?
It won't happen because
I don't want to hear any of this. I just want to go home.
All right, I'm really sorry I asked.
No, I want a discharge.
Miss Sonia, getting a discharge and going back home is not a solution.
And you know what? When she appeared to me into my room, she just reprimanded me. She wouldn't listen.
Oh, that's really bad. Yes. Don't worry, Miss Sonia. I'll take a strict action against those nurses.
I don't want to stay.
Yes, I will take a strict action against those nurses and I will get to the bottom of this. What was the exact reason? But what I think right now, it's just because of the understaffed. We have to care for more than 4 or 5 patients. That might be a miscommunication that happened over there. I'm really sorry once again.
Then how are you so sure that this won't get repeated tonight?
Just because of the flu outbreak yesterday, we were understaffed. And after that, those who were on leave have been called back. So we won't be understaffed again. And the flu is also in control.
I don't want to listen out to all this, okay?
Right.
Because I have my mother and my husband at home and they will take care of me so much more better than this.
I'm really glad, Sonia, that you have your family members to take care of you at home.
So I want to go home.
Yes, but you won't be getting the quality of care, the appropriate medicines. What if the doctor changes the medicine after a round in the morning? How am I going to inform you? So you have to be in the hospital. What if you develop certain complications related to the surgery? Who's going to take care of you there? Please, would you think about it?
Okay.
Thank you so much, Miss Sonia, to understand the situation. Is there any other concern that's bothering you?
No, none at the moment. But I just hope that such a situation will not get repeated.
Oh, no, Sonia, no, Miss Sonia. It will never, ever repeat again. I assure you that. Because I'm here for the following days. I'm having morning duty and I'll be coming to the ward every day morning. If there's any concern, if there's any botheration, you can directly talk to me. I'll be coming to your bedside and you can directly talk to me, address your concern. How does that sound?
Yeah, that sounds nice. I think I'll stay.
All right, that is really good.
Thank you.
Thank you so much.
Now that we have completed the role play, I would like to spend a few minutes giving feedback on what we just presented. All role plays are assessed by two criteria. Number one, we have the linguistic criteria, and number two, the clinical communication. Linguistic criteria includes intelligibility, which was handled well. He was able to comprehend the task well. Under fluency, he had a free flow of language, he used the right words, and he was fluent. The third one is appropriateness. Though his language was good, he repeated himself a number of times. The fourth criterion is resources of grammar and expression. Here, he made a couple of grammatical mistakes, but in expression, his intonation was good. Under clinical communication, we have relationship building. Here, he created a strong rapport with the patient. Next, we have understanding and incorporating the patient's perspective. Here, he was able to understand the patient's feelings and give adequate assurance. Number three is providing structure. He maintained integrity in handling the patient's concerns one after another. Finally, we have information gathering and information giving. In both these criteria, he was able to do justice and fulfill the need by asking questions and giving a convincing solution. Finally, the patient was convinced. I hope this presentation has been beneficial to all OET aspirants preparing for the exam. For more details, drop in at Medcity International Academy, Thiruvalla, or contact us at 8943789999 or 7034849999. Thank you.
Medcity International Academy. Trusted hands forever.